Okay, hi. So I'm really excited to welcome Dr. Jenny Lowell. I'm going to have Dr. Lowell answer a question for us that'll be helpful. We're going to say, what have you learned from our relationship that has helped your patients with pelvic floor dysfunction the most? And if you could introduce yourself a little bit, that'd be great.
Yeah, my name's Jenny Lowell. I'm a OBGYN in Burlington, Vermont, and I've known Vicki since probably 2004, I'm going to guess.
Mm-hmm. I agree.
When we started working together before we moved into the building that we're currently in, and now we're in a nice collaborative healthcare building. So my OBGYN practice is on the other side of the hall from her chiropractic practice. And what I learned the most from working with Vicki and her husband is that I should think about musculoskeletal problems as a source of patients' pain. So when I think back to my training and residency, all the focus on pelvic pain was all on organs. It was what's the ovary doing, what's the uterus doing, is there endometriosis? And I really learned pretty much nothing about how the muscles might be contributing to pain. And so certainly if you couldn't find an organ problem for the pain, you really sort of put your hands up and said, well, I don't really know what your problem is. And that's pretty frustrating for you as a clinician. It's pretty frustrating for your patients. So through my collaboration with Vicki, what I've really learned is that I should pay attention to the pelvic floor. And so specifically for me, I've really changed my pelvic exam. So I certainly start with the anterior component. I palpate the uterus, I palpate the ovaries. But if I don't really find a source of the problem, I now know to turn my hand and palpate the muscles in the back of the pelvis.
Awesome.
And so Vicki's great about kind of going over which muscles which, the iliococcygeus and the pubococcygeus. And I know that if I can't quite put my finger on the name of the muscle, I can just send people to Vicki and say, yeah, there's something wrong in the back of the pelvis. That muscle's tight, that muscle's loose. And so just explaining that to patients, like I'm going to do a different type of exam than your normal pelvic exam, and I'm going to turn my hand now and then really palpating those muscles and looking for what I call hot spots, like, ooh, that's a trigger point, that really hurts you, that replicates your pain. And it's been great for patients because a lot of times on the exam, I can palpate something and they say, that's exactly what my pain is. That's exactly causing the pain that I'm describing to you. And then I know I can send them to Vicki and she is going to make them feel better. And I can reassure the patients, it's not going to be 6 months of PT where you don't really know if you're getting any relief. That typically within even the first 2 visits, patients really say to me, oh, wow, I feel a lot better. And so not only has she taught me to really think about the pelvic floor, but also think a lot about the psoas muscle and how that inserts into the pelvis. So I have a lot of patients who come in thinking they have a ruptured ovarian cyst, and I do the ultrasound and nope, everything looks good. And then now I palpate their psoas muscle, and I find a lot of people, their pain is actually coming from tight psoas muscles. So I think what's been so great is it's opened up a whole new range of diagnoses for me. So if you don't even know to make a diagnosis, because you don't even know that thing exists as a diagnosis, how on earth would you then know to go for treatment? So they've really helped me not only with the diagnosis piece and thinking about the pelvic floor and the muscles, but also then like, oh, great. Not only do I know what's wrong with you, I know who's going to treat this.
Awesome. Thank you.
Yeah.